Hello everyone, I hope you are doing well. So my name is Jasleen Kaur. I am a postdoctoral researcher at the Ubiquitous Health Technology Lab at the School of Public Health Sciences at the University of Waterloo in Canada. So I'm recording this presentation for the Data for Policy 2024 conference. So today I'll be presenting our study on the influence of the COVID-19 pandemic on the population level behavioral changes, an IoT-based study in the US conducted with the other co-authors, the Arlene Oetomo, Vivek, Chauhan, and Professor Plinio P. Morita. Okay, so I'll start with a brief introduction and background. The COVID-19 pandemic, it started in late 2019 and declared a global pandemic in March 2020. And to mitigate this virus spread, the work from home policies, they were widely adopted, shifting the work environments from the offices to the remote work. And this shift, it led to the significant changes in our daily routines. That includes the decreased physical activity due to the lockdowns, the increased sedentary behavior with the more screen time, and also the disturbed sleep patterns. So basically understanding these behavioral changes, it is essential for the effective public health interventions and for evaluating their impact on the health. Now, what is the significance of the public health surveillance systems and their current state, particularly focusing on their role in monitoring the population level behavioral changes? We know that public health surveillance, it is a continuous systematic collection, analysis, and the interpretation of the health related data that is needed for the planning, implementation, and evaluation of the public health practice. And accurately monitoring of these population level behavioral changes is important for achieving the triple aim of the healthcare, that is improving the patient outcomes, improving the access to the care, and making the healthcare systems cost effective. Okay, now the current state of the public health surveillance system, it depends upon the traditional and the modern data sources. At present, the Canadian public health surveillance system, it relies on the self-reporting and the short-term activity monitoring to collect the data on the health indicators included in the PASS indicator framework, the physical activity, sedentary behavior, and the sleep indicator framework. And in the United States, we have the behavioral risk factor surveillance system, which is the largest telephonic health service system. And in 2020, during the pandemic, the BRFSS was used to collect the data on the COVID-19 and the health risk behaviors in the different states in the US. So while these traditional methods, they provide the variable insights, but they have their own set of the limitations and challenges. So if you'll see the self-reporting, it is often prone to recall and social desirability bias. And there are often delays in the data collection and reporting, which means we might not capture all the relevant health behaviors and the metrics in the real time. On the other hand, if we'll see the objective measures, the connected wearable devices, they have transformed the data collection method in the public health research, but despite their potential, these devices, they also come with the challenges. User needs to remember to wear these devices. Their mental energy is needed to put on these devices, to not to lose that devices. Also, to manage the battery life and to deal with the data quality issues. So combining the strength of both the subjective and the objective approaches will enhance our ability to monitor and improve the public health surveillance systems effectively during these extreme events like COVID-19 pandemic. Now, there are different existing studies using the traditional and the modern data sources focusing on the PASS indicators. Now, considering the limitations of these existing data sources, what are the alternate data sources? Basically, to improve the public health surveillance challenges. So we in the UB lab, we are developing the novel ways of extracting and monitoring the population level behavioral changes using the IoT data sources, where basically the advantage, it includes the real-time data with a high frequency, high volume, and the zero effort data collection method. So when I'm saying the zero effort data collection method, the zero effort technology is basically an emerging class of the technology that requires little or no effort from the people who are using it. Okay, so the objective of this research study is to develop a novel framework using the zero effort technology to analyze how the COVID-19 pandemic has impacted the population level behavioral changes in the US. So I'll brief about this novel data source first, which we are using in this research. So DYD is the Ecobees initiative, a smart thermostat company that basically aggregates the pre-consented and the anonymized data from the thousands of the smart thermostat users worldwide, and they share this data with the researchers for the further energy and the sustainability research. And our lab, the UB lab, is the first research lab to use this data basically for the health purpose, and has gained the access to the large data repositories through this research partnership. So if I'll talk about this data consists of the two parts, the metadata and the thermostat data. So the metadata is the household information like the geolocation of the house, the country, province, and the city, the size of the house in the square feet, the number of the floors, the age of the house, the number of the remote sensors in the house, and the number of the occupants and the individuals. And if I'll talk about the thermostat data is basically the date time stems where the granularity of the data is a 5 minutes, and it includes the indoor temperatures, the humidity, and the binary data indicating the room occupancy through the PIR motion sensor. So initially we started this work with the 5 years of the data from 2017 to 2021, where the total size of the data was approx 8 terabytes, and now we have access to the new data as well. Now, before starting this extensive research, our lab conducted the proof of concept study, basically to validate the accuracy and the feasibility of leveraging this data from the IoT devices. So the objective of this study was to validate the relationship between the Ecobee remote sensors activation and the movement within the house, and to test the accuracy of these sensors. So the study demonstrated the strong association between the sensor activation and the number of the steps recorded via the Fitbit. So these results, they indicate that the data from the smart thermostats, it can be effectively used to measure the population level behavioral indicators, and this study has already been published, and you can check this basically the details about this study through the provided link. Now this is the methodology and the data pipeline framework which we have developed for this research, collecting the Ecobee data, managing it, and presenting it to the public health officials. So we have developed and used this pipeline for the various research studies to analyze and extract the insights from the motion sensor data collected from the Ecobee smart thermostats and generating the behavioral health indicators. So we have used the different data pre-processing steps to address the missing data and filtered the US household specifically for this study. We selected the required fields from the data frame, created the new variables, and adjusted the data granularity from 5 to 30 minutes. And we also selected the households having at least 200 days of the data available. So when I'll talk about the software part, we use the Microsoft Azure as a cloud platform, the Azure Gen 2 data lake for the storage, Apache PySpark framework for the big data processing, and the Python programming and Azure Databricks for the data processing and analysis. Then we use the machine learning models and the statistical analysis. We analyze the patterns of the movement within the house by the time of the day. We use the Gaussian mixture model to identify the sleep parameters by segmenting the sleep cycle records into the different clusters to understand the variations in these sleep patterns. And after generating these behavioral indicators throughout this methodology, we looked at the impact of the pandemic on these generated indicators. The data security and confidentiality within this research study, they are ensured using the secure Azure platform. Our Microsoft Azure storage is NIST compliant, that ensures the secure and the regulated data management. Also, we implemented the role-based access to limit the data access to the UBLab researchers, and the DYD initiative also provides the anonymized and the pre-consented data that protects the user's privacy. So these are the derived behavioral health indicators we generated from the DYD dataset. So these indicators were selected based upon the comprehensive literature survey of the existing studies that use the PIR motion sensors and the bed sensors to measure the sleep and the activity metrics. So in the initial stages of our research, we focused on the existing set of the health indicators from the PASS indicators framework. Then we selected the specific indicators based upon the existing literature survey and the studies that use the PIR motion sensors and the bed sensors to measure the various sleep metrics. And this table summarizes the relevant studies we considered. These studies, they involved the different subjects, including the healthy individuals and the elderly, using the range of the sensors and the metrics over the various durations. Okay, so I'll be discussing now some of the findings with this novel data source and the framework. Okay, so these are some of the household level findings. This is one of the household from New Mexico having the 3 occupants and the 5 remote sensors. So this heat map is showing the difference in the movement patterns before and during the COVID-19 pandemic restrictions. So if you'll see the plot x-axis, it is representing a day, and the y-axis is representing a time window of the 30 minutes interval. And the lighter the color here, the higher the sensor activation. It means the more sensors activated in the house during that time period, and the darker is the color, the lower is the sensor activation. So if you'll see the number of these sensors activated for each time interval in 2019, they are lesser than the year 2020. And if you'll see, there is an evident change here in the sensor activation immediately after the declaration of the COVID-19 pandemic in March 2020. Okay, so these are some other findings on the New Mexico dataset on the average time spent indoors and outdoors before and during the COVID-19 pandemic. For the indoor time, if you'll see, before the pandemic, the people spent an average of the 5.1 hours indoors, and during the pandemic, this increased significantly to 6.7 hours. That is reflecting in the data for each day of the week. And the paired t-test confirms that these changes are statistically significant with a p-value less than 0.001. And these graphs on the right hand side, they are also comparing the average indoor and outdoor durations, which is basically highlighting the shift in the behavior during the pandemic. So with the generated sleep indicator, these are the findings from the different US states. The state of the California and the Texas were selected for this study because they had the highest number of the Ecobee devices in the divided dataset, and they had the variable political leanings between the cities and have a large population. So for this study, basically we calculated the average sleep duration in the California and Texas, and we checked that its variation with the COVID-19 timeline, the geolocation, and the political parties. And what we found that the average sleep duration, it decreased across all the democratic cities examined, with the greatest impact seen in the California, the city of San Diego. And within the Republican cities, the pandemic had a variable impact on the sleep duration. And the Fort Worth has the largest reduction of the average sleep duration, whereas the Fresno households shown the increased sleep durations. So in our ongoing work, we are integrating the indoor temperature and the humidity data from the DYD dataset to study the impact of the climate variations on the generated indicators, specifically the sleep health indicators. And we are also evaluating the impact of the extreme events, the heat waves, on the sleep health of the elderly using this IoT-based big data from the smart thermostats. Additionally, we are also developing the dashboards to provide the insights and the evidence-based information on the behavioral health to the users and the public health officials. So these dashboards will help in visualizing and understanding the changes in the behavior patterns during these extreme events for basically better decision making and for the policy formulation. So in conclusion, our research, it introduces a novel approach basically to monitor the behavioral health indicators using the zero effort technology. We have used the IoT based big data to generate the indicators such as the sleep duration, the disturbance time, indoor and outdoor time. So this is the first study to use the zero effort technology for the population level surveillance, which is basically offering the detailed insights into the behavioral health patterns. And our findings, it highlights the potential for basically the IoT based data to inform the public health policies, specifically in understanding and responding to the behavioral changes during the crisis like these COVID-19 pandemic health crisis. And the evidence supports the development of the near real-time surveillance system, enabling the timely intervention to monitor, to promote, and to improve the behavioral health. So these systems can inform the policy decisions and can enhance the public health responses. Okay, so this is all related proposed work and the initial analysis results that have been published and presented at the various conferences from this research study. So you can check these publications and the different presentations for the more detailed insights and the findings out of the study. So I would like to acknowledge the contributions and the support that have made this research possible. Our supervisor, Professor Plinio Morita, and all the co-authors and the funding partners and the UB Lab team. I would also like to acknowledge the Microsoft Azure for the research credits. So thank you everyone.